Hello, I am Dr. ManjiriValsangkar, Director, Bhide Hospital Test Tube Baby Center, Navi Peth, Pune. Today, let us talk about the relevance of AMH testing and infertility. Now, whenever infertile couples or childless couples approach us saying that doctor, we cannot conceive, the first thing which we do is to find out the reason behind that. And in a pursuit to find out or diagnose the cause of infertility, basically there are two types of tests which are available. Let us keep the male partner aside for a while. So when we consider the lady, we do hormonal testing on the second or third day of the menstrual cycle, which mainly includes an important test which is known as AMH test. And today we are going to talk about this AMH test and its relevance to fertility. Apart from the AMH testing, a very good quality antral follicular count sonography can be done in the first 3 to 4 days of the menses, which will tell me both sides ovaries, do they have good recruitable follicles or antral follicles in that particular cycle. Now, coming back to the AMH testing. AMH is anti-Mullerian hormone which is present in all the females. Anti-Mullerian hormone basically tells us the ovarian reserve of that patient. So, whenever a lady is in her 20s, her ovarian reserve is great. She has tremendous number of mature follicles which can make a baby, and hence she is having a very good ovarian reserve. In a patient who is 35 or 40 years and above, this ovary has almost come to reserve. So the ovarian reserve is all exhausted, and hence this particular lady would have a low ovarian reserve and hence a low AMH value. So if we have to see the AMH testing, the AMH is a blood test which is done by various methods, but the Beckman-Coulter 2 method is the best among the globally currently available methods of testing. AMH can be done with or without empty stomach. It can actually be done on any day of the cycle because it is the age specific ovarian maturity or ovarian reserve testing ratio. Hence, as the age increases, your AMH will go on decrease. So, as the lady progresses more than 35 years, she goes into a low ovarian reserve category. If we have to interpret the AMH test, AMH more than 4 to 6 international unit may indicate a mild PCO, but she might conceive without any assisted reproduction methods. So basically she comes under a good ovarian reserve. AMH 2 to 4 comes under a normal ovarian reserve, but if you have tried for more than a year's time and if unable to conceive, better to see your fertility physician and you might proceed with a IUI cycle. AMH less than 2 is a low ovarian reserve and may require test tube baby technology to be done to make a child. AMH less than 1 is a very low ovarian reserve or an alarming ovarian reserve, in which in spite of doing an IVF, we might find out that because of the age-related ovarian aging, the quality and the quantity of your mature oocytes in the ovary, which are known as the M2 oocytes, may have been exhausted, and such patients might require a donor oocyte program. So, if you are a patient who is suffering from infertility and if your AMH is low, please talk to your IVF physician frankly about the options of treatment, and that this is definitely an alarming sign if your AMH is less than 1, that you need to hurry up and increase the level of your technology, which might be even IVF or other types of test tube babies which are available. Thank you.